I'll just jump right in, try to be as brief as possible, get to a number of the issues of the day, particularly as it relates to some of the regional orders that now are in effect in the state of California, but also wanted just to provide some context and some information about some new technology that we're bringing to bear to slow the spread of COVID-19. There's been a lot of discussion around apps. There have been a lot of discussions about how technology can advance our efforts to notify individuals, mitigate the spread of COVID-19, and address this pandemic head on. Two of California's best known headquartered technology companies, Google and Apple, have joined together in an effort to provide for exposure notification, not contact tracing, but exposure notification. I want to provide you a little bit of information about what California is doing today to help support their efforts, a little bit about the work that we've been doing with Google and Apple over the course of the last number of months with a pilot program, particularly at our UCs. But you can see here that the California Notify app we're putting out is about an opt-in opportunity for individuals to participate in a notification protocol, an opt-in, not an opt-out, privacy protected. This is not contact tracing. This is notification technology. You can choose to participate in leveraging this technology to allow people that you have been in contact with or have been in contact with you to be notified of potential exposure related to the transmission of this disease. I remind you, it's 100% private, 100% secure, 100% voluntary. You opt in or you choose not to, and there is no tracking data, no location data that is shared as parcel of California Notify whatsoever. But first, let's update you on the regional stay-at-home order that went into effect after regions fell below 15% of the remaining ICU capacity. Remember, California, size and scope of the state, it's the equivalent population of 21 states combined. So often is the case as we talk about other states, national media and others, California is just considered like another state, when in fact California in so many ways is unique and distinctive because of the scale and scope, the size, not just the diversity, but the regional diversity of California in particular. And in each region are different resources, different capacity, and as a consequence, we've looked at 5 regions and not just one state, 5 regions where there is a connective tissue between, literally and figuratively, between the hospital system and the critical care system in terms of relationships and mutual aid protocols and a framework of proximity that advantages our critical care delivery. The regional stay-at-home order now, because 2 regions, San Joaquin Valley and the Southern California region, the largest region, which in and of itself is a unique U of sorts. These 2 regions now have fallen under the 15% ICU capacity. Hope is on the horizon with a vaccination. We continue to accelerate our planning and preparedness for a safe and equitable vaccine distribution. Emphasis, safe and equitable vaccine distribution. We have been highlighting over the course of the last number of weeks our progress on vaccinations. Let me update you on that progress. We again are working off a plan that assumes 327,000 doses that come from Pfizer directly will avail themselves as early as the 15th of this month. For planning purposes, we've had it around the 12th to the 15th. But for the purposes of this slide, we're saying roughly around mid-part of December.
I wanted to ask, and maybe this is a question for Dr. Galley if he's there, about the timing of these new stay-at-home orders, given everything we've learned since March. Was there discussion of putting in place a broader stay-at-home order, say before Thanksgiving, instead of a curfew? Just can you give some sense of how those discussions went? And can you talk about how much you think gathering during Thanksgiving is contributing to the surge now?
Good. No, I appreciate it. And Dr. Galley is here, and he'll come up just in a moment. Look, I mean, the vast majority, overwhelming majority of Californians are now in this new stay-at-home order protocol. So let's disabuse ourselves that just because it's 3 out of 5 regions that somehow we are neglecting a significant number of individuals. We certainly have 2 other regions that are not in this order, but the vast majority, overwhelming majority of the population of the state is. Look, as it relates to the conversations we had, I can assure you we've had many conversations, and we've been gaming this out based upon the facts. The facts determined the when. The facts were ultimately determined on the basis of engagement with local health officers on the how. And with that, I will happily stand aside and provide Dr. Galley to talk a little bit more about not just the how and the what, but also the why we are here and the basis of the question you asked specifically around concerns with Thanksgiving.
Thank you for the question, and thank you, Governor. Indeed, you know, since the beginning, that very first stay-at-home order, we are constantly looking at the various actions, not just regionally, but statewide. And as we move through this current surge, we've been asking the question about what are the right actions, looking at the data, as the governor mentioned, throughout to determine what we would do. We know that these various restrictions are a hardship for people. It's not what we expected at this time of year, but we know some of them are required to make sure we get through the surge as quickly as possible and saving as many lives and preventing as many infections as we possibly can. So certainly through the months of October and November, discussing with our local partners the right actions to take, the timing of those actions, moving through in a stepwise way, adding various restrictions, and then getting to the point very recently, looking at the ICU capacity, looking at our ability not just to care for COVID, but to care for all emergencies and critical health issues in our hospital system, the decision to go with the regional stay-at-home order. And your question is a very important one as it regards to Thanksgiving transmission. We know that those cases that occurred around people's potentially dinner tables or activities and plans, travel through Thanksgiving, are going to show up right about now. Maybe the last couple of days we're seeing that, but we know we'll be seeing that for many days to come. So not that this is just the beginning, but we believe that the levels of transmission that we've been reporting so far will likely continue to go up some because of those activities around Thanksgiving. So all of these are coming together, these actions, these signals in our data to cause us to do the regional stay-at-home order the way that we did. Thank you.